for tonight's Big Picture Rumble are Scott Greer, Associate Editor of the Daily Caller, Lee Camp, host of Redacted Tonight with Lee Camp here on RT, which airs right after this program, and Hughey Newsome, founder of The Objective Citizen and a member of move-on-up.org. Got to get it right, Hughey.
You are getting it.
Thank you all for joining us tonight. Okay, thanks to ObamaCare, the percentage of Americans without health insurance has rapidly declined over the past few years to just 9%, the lowest level ever. The law isn't perfect, but it's a very good start, which makes it all the more stunning that not one of the Republican candidates at last night's debate offered any alternatives to the program besides repeal it. Isn't this just more evidence that the Republican health care plan really is, as Congressman Alan Grayson said, don't get sick, and if you do get sick, die quickly?
Well, I would say that's what you mentioned at the beginning. That's a little bit of fear-mongering, but I do think Republicans do have a major issue of what to do with Obamacare. It's one thing to say repeal it, but you have to offer an alternative to it. And when you see if you repeal it, millions of people have gotten health care through Obamacare. So even though millions of people have had seen their premiums go up under Obamacare's regulations, they have to, by telling more other millions of people, like, we're going to take away your health care, is not a feasible issue in an election cycle. So what Republicans really have to do, in my opinion, is offer a reform of Obamacare and try to eliminate the aspects of the like. I mean, people don't like the medical device tax. There's other issues that are penalizing doctors.
Nobody would
and others.
even notice that.
But there's a lot of measures wrong with Obamacare.
If I may, I have interviewed and debated conservatives in a half a dozen countries. You know, we did our show for a week from Denmark, and I got like the head of the parliament and the guy the publisher of the newspaper with the cartoons. You know, who's like so far he's like, you know, Marie Le Pen, and I to every one of them I say, you're a conservative, you must hate your national health care system, and they always say, no, what are you, crazy? We like our national health care system. It seems that, you know, what I've seen Republicans do in the states with Medicaid expansion is just try to figure out a way to skim some of that money off the top and give it to private health insurance companies. Is that all conservatism means in the United States?
European conservatives are a lot different from American conservatives, but that's not that important to the discussion.
How?
And I would say Denmark is a completely different country from the United States. It's much smaller, very different culture. Fewer people that they have to take care of.
Between Germany
and also a very different country from the way the United States is. I mean, what works in one country is not necessarily going to work in the United States. The total population of Europe
is 800 million people. It's three
and
times the size of the United States.
But not all of Europe has the exact same healthcare system as Germany or Denmark or Sweden.
At least 90% of it.
And a lot of countries are seeing that they're not able to take care of that type of healthcare system. We see that in Greece. We're starting to see that in Ireland and other countries where they're not able to take care of other generous.
That's being on the euro.
But that's
okay. Let's get some other people.
Generous social services.
Part of the problem is the fact that Greece has a nationalized healthcare system, in which the economic growth has not been able to sustain that national healthcare system.
But the problem Greece is dealing with right
that's
now.
part of the problem that Greece is dealing with. Everything's
really
nationalized, and there is not enough of economic growth.
They're dealing with the fact that they don't have their own currency. That has nothing to do with healthcare.
I think the fact that I know we're not supposed to be debating this, but I think the fact that that part of the eurozone has saved them and kind of glossed over some of the economic problems that they've had before. Now they're being forced to address those problems.
And paid off the banks while crushing the people. That's not saving them.
You have to borrow the money before the banks you are a debtor to the banks in the first place, which means that you don't have enough money to cover your bills.
But that's because Goldman Sachs ran a scam on them with them so that they could get into the eurozone, as you'll recall. And then when then Goldman Sachs got their money and the Greeks were left.
Well, I mean, austerity is a completely different issue from that. I mean,
but why are we talking about this rather than what the Republican plan for health care is? I'd still like to know, what the hell is it?
Well, that's the thing. I mean, I think that Republicans are focused on, you have to stop Obamacare at this point before it gets too entrenched into the American economic system, into the healthcare system, and then you fix it. And I think that's the approach that Republicans have been.
In other words, you don't have a plan either.
The Republicans have been proposing potential solutions to Obamacare, alternatives to Obamacare since '09. Remember, this was only until
I have not heard one serious proposal.
Absolutely.
Republicans, however, have been proposing Obamacare since 1980s.
Yes.
You know, when the Heritage Foundation first came out and said, "Here's a great
idea."
I know this is what actually Richard Nixon proposed Obamacare in 1972.
Well, here let's look medical savings accounts, right? So we could talk about the merit of that, but let's not say that the Republicans haven't proposed alternatives, right? So making insurance portable, right? giving MSAs
That's
to
not an alternative.
Yes, it is. It's an alternative. It's an alternative
That's a
approach.
tweak around the edges that basically cuts all the state insurance commissioners out of the program.
Well,
and that's
not
the
do
goal.
it? It was a central
Because the
tenet.
state insurance commissioners
It was
protect the customers.
it
Now,
was
I understand Republicans don't care about consumers, but most consumers do. And they want a state insurance commissioner who they can complain to if they get screwed by their insurance company.
tort reform, which is also something that was piloted by the president and by the HHS during, I believe it was 2011. That was some pilot program that was put up to. So there are alternative approaches and solutions that are being explored. It's just not seeing the light of day because the mainstream media is not allowing it.
Just had 7 years to come up with it. Lee, you have not. Sorry.
Well, I'm the crazy lefty who thinks maybe corporations and this massive health insurance industry that we have shouldn't be involved in our health. Maybe profit is not something that should be gained out of people's health. Maybe we should just be taken care of, and it's something in a rich society that we should be entitled to. That number one cause of bankruptcy should not be health care.
So this argument
And the Republicans claim to care about small business, and meanwhile, the number one cause of bankruptcy, they were fine with the way it was.
So you're
that's
basically
cool.
saying I have a right. I have a legal right to health care.
Yes.
Yeah.
That's what you're saying.
Yeah,
I'm saying,
in a rich society, in a big rich society,
that means fundamentally somebody else has an obligation legally to provide me a service.
not true.
Whether or not it's economical
that's
to
not
You have
how
a
that
right to
works.
free speech. It doesn't mean that I have an obligation to give you a microphone.
Okay, well, somebody's forced, if that's a right, somebody is forced to have to provide that service to you.
No, you have a right to own a gun.
Absolutely.
I'm not being forced to give you one.
I disagree with that argument. I mean,
Just because somebody has a right to something doesn't mean that
But somebody
they're
has to pay
forced.
for it, so somebody's legally obligated
not
to
like
pay
forced
for it.
Somebody has to
There's-
make that gun.
Yeah, this is. I mean, you all have to
Hold
understand.
on, someone has to make that gun. Are they
that-
forced to make you a gun?
This is the idea of a positive right. If I as a human or if I as an American have a right to receive something,
You have a right to a
then
gun.
somebody is obligated
Forced to make the
provide
gun,
it to me.
right? Someone's forced to make that gun.
No,
for
I
you,
have a
right?
right. That's different, though. I have a right to own a gun as opposed
You
to
have a right to vote. Is somebody
Somebody,
forced to drive you to the polls?
I have a right to own a gun, but I have the option to do it. But
Here's the difference between the
This
gun
little
issue.
specious argument.
No,
I've
here's
never
the difference with the gun
Break
issue.
your leg, you don't have to go to a hospital.
The American government is not forced to buy everybody a gun. If everyone has the right to health care, everyone's going to have that health care. So that's going to force people to pay for that health care, and most importantly, the government. Comparing that to the gun issue is basically saying you have a right to gun, everybody gets a gun, and the government's making that gun for
Okay,
you.
you're making a good point. So basically what we're saying is the same thing that was said in 1933 about Social Security. Everybody has a right to a retirement without poverty. So how are we going to fund that? We're going to get everybody in the country in on this because everybody in the country has the
you
right.
can self-fund
And if
that.
everybody in the country has a right to health care, what about, like Bernie Sanders' plan, 2% payroll tax, 6% payroll tax for the employer, and, it goes up to 5% for people making over $1 million a year, and a small tax on Wall Street, and bang, you've got national health care.
I can self-fund my own retirement account, but the problem that you're making
Probably not
is
that you could retire
whether
on.
or not it's economical for me to provide you medical care or health care, I still have to.
I'm not
provide
asking you to provide it to.
it. Okay, somebody does.
Well, no,
Somebody
this is
does.
the whole point
And
of,
do we get
single-payer health care is we all provide it to ourselves.
Well, somebody has to actually do it. What happens if it's not economical to do so? Then you have rationing.
No.
You could bring the $11 trillion that are in tax havens from corporations and fund healthcare for eternity. Like,
Repatriation. Okay, so
More of tonight's Big Picture Rumble after the break.